12. With us today, we have Brenda Rich from HTA Financial. Brenda's been with HTA for a number of years now. She is a Medicare specialist, and she utilizes, a number of her life experiences to help people with navigating the world of Medicare and all of the changing things that are associated with it. Brenda is a Drexel grad. She is a member of the board for Flagship Cancer Research. She's also a member of the Hatboro Horsham Education Foundation. And she is the founder of Dan's Voice in memory of her late husband. And this is an organization for raising funds and awareness for individuals with esophageal cancer. And Brenda lives locally in Horsham, Pennsylvania. So I've been working with HTA Financial and Brenda for a number of years. I know Tracy Russo, the owner of HTA, dating all the way back to when we were 22 years old, which was a very, very long time ago. And Tracy and her group are second to none when it comes to discussing the Medicare supplemental plans and how to go about navigating this very elaborate world. And as the regulations change and pricing changes, they are just a great resource for us and our clients to have, specifically to just give you a once over on what it is you currently have going on and how they may be able to make your situation better, whether that is through changing plans or just educating you. That's to be determined. So I highly recommend that if you have questions above and beyond, the conversations we have or you have with your individual advisor at the firm, please make sure that you reach out to HTA and that group to just be another resource for you to really get into the weeds with you to make sure that you're making an educated decision moving forward. So I don't want to take any more of Brenda's thunder. You're here to listen to her speak, not me. You hear me talk enough. So Brenda, thank you for joining us today. And we will open this up at the end for some level of Q&A. But our goal is to keep this to an hour long so everyone can get back to their day. So Brenda, if you won't mind taking over, and thank you all for joining us again.
Well, thank you so much as well. I am thrilled to be here to do another lunchtime learning session and to talk about Medicare. And we love helping Flagship Financial clients. And we appreciate that you are listening to us today. So to talk at a very high level, what I'm going to go over in this next hour are things that are probably most important to you: the costs, the benefits of Medicare, and probably the most confusing part of Medicare is the when. When should you enroll in Medicare? Now, before we do that, I would just like to give you a real high-level overview of HTA, what we do, who we are, why we're a little different. We provide free and unlimited phone support to anyone that is either approaching age 65 or maybe approaching retirement. We have been as Dean had indicated, we've been in the insurance business for a very long time, and we have access to over 35 insurance companies nationwide. Now, what makes us a little different, everybody in our office is salaried, we're not commission-based, and I can honestly say there is never pressure to buy. Our goal is to educate. When you call our office, we want to make sure that you know what your options are, because as you approach age 65, you're going to be getting a lot of information sent to you in your mailbox, in your email, maybe the phone call, and you're going to be opening or listening to these messages, and they're going to be a little scary. And they might even say things like, if you don't enroll now, you're going to get a penalty or you're going to miss a deadline. So Medicare can be overwhelming, and we're here to simplify Medicare for you. And I do just want to say this is a complimentary service. There's no cost to you, your family, or friends. Anyone who needs help, we can help nationwide. And you're probably sitting here thinking, okay, what's the elephant in the room? How do they stay in business? And the only thing is, if you call our office and you like working with us and you agree with our game plan, our roadmap for you, then when we do the paperwork, that's how we stay in business. And oh, good news, you never pay a higher premium by enrolling through us rather than going directly with the insurance company. So enough about that. Let's get to the nitty-gritty of Medicare, and I am going to start with, here we go. I'm going the wrong way here. Sorry about that. What is Original Medicare? Original Medicare is health insurance for individuals that are age 65 and over, or are under 65 and have been on Social Security disability for 24 months, or have end-stage renal disease. Now, Original Medicare has nothing to do with your normal retirement age, and that is the age for when you can collect your Social Security income. To have a full comprehensive healthcare package when you retire, you're going to need 4 parts and pieces of Medicare. We're going to start out with Original Medicare, which is funded by the federal government, includes Part A, which is your hospital inpatient, and then your Part B, which is your medical outpatient. Then you're going to want to add on secondary insurances in the form of private insurance companies from either a Medicare Advantage plan, also known as Part C, or a Medicare Supplement plan, which you might have heard the terminology of Medigap plan. And then lastly, you'll need a Part D. So you'll need a combination of all 4 of those parts and pieces to have a comprehensive plan. I want to start and dive deep into the Medicare Part A first. Medicare Part A generally has no cost to you, provided that you and or your spouse have worked a minimum of 40 quarters or 10 years. Now, to remember that, we always counsel hospital admission, so it's A for admission, is covered under your Part A. It also, Medicare Part A, will help cover the inpatient care in hospitals, skilled nursing facility care, but on a limited basis, hospice, and then home health services, and that's limited as well. Now, Part B is generally everything else. That's your outpatient medical insurance. So that's going to include things like doctors and specialists, your diagnostic testing, such as labs, X-rays, and MRIs. It also includes outpatient procedures, so think of surgery and chemotherapy, and the non-inpatient hospital procedures, like emergency room or, hospital observation. That's a relatively new terminology where you might physically be in the hospital, but technically not admitted and be coded as observation. Well, Part B would cover that hospital observation. Part B also covers durable medical equipment and then some preventive services. Now, where Part A is premium free, there is a premium for Part B, and there's a premium for everyone. The base premium for 2022 is $170.10 a month. And if you're looking and following along on this chart, you can see your Part B premium is based by your income. So a person and a family that files jointly would fall into that Part B base premium of $170.10 if their adjusted gross income, their modified adjusted gross income, was up to $91,000, or if they file jointly, up to $182,000. So you would fall into that Part B premium baseline. And if you're following along, you can see as your income increases, so does that Part B premium, with the highest wage earners having a Part B premium of $578.30. Now, there's a couple things that I want to say about this chart, this premium by income. This is a per person, per month income. So a Part B premium income. A lower wage earning spouse will not get a lower Part B premium. So it's the same premium for each spouse, and it's based on your modified adjusted gross income from a rolling 2-year look back. Now, that modified adjusted gross income is not a clearly defined number on your tax return. So if you want to get pretty close to what Social Security is looking at, you would look at your adjusted gross income. Okay, did something happen? I got kicked out?
I can hear you fine, Brenda.
Oh, okay, because I just got a message. I'm sorry, can you see my screen?
I can see your screen fine as well.
Okay, thank you. I don't know, I got a weird message. I'm very sorry about that.
It's okay.
Okay. So let me just, there we go. All right, so it's Social Security looks at your tax return from 2 years ago. So every year in December, you will get a letter which will tell you precisely what your Part B premium will be in the upcoming year. Now, for some of you that might be on the call today, you're sitting here and you're thinking, I fall in one of these higher Part B premium brackets. Am I always going to be assessed at this higher rate? And the answer is no. So eventually, if you wait out that 2 years, then Social Security will eventually figure out that your income has been reduced. But if you don't want to wait the 2 years, which I would suspect that many people would prefer not to spend that higher Part B premium amount, you can file a life event form and appeal these higher Part B premiums. And we actually have helped quite a few people appeal these higher Part B premiums. And Social Security is actually pretty good about granting these appeals. Okay, next thing. What this chart is called what Medicare does not cover. But I actually always like to tell people Medicare covers an awful lot. There's just a few things that it doesn't cover. Medicare does not cover routine dental, vision, and hearing. So let's say you needed a quick eye exam, or you needed a dental exam. You would need to have a standalone dental and vision plan. But there's a flip side to that. Let's say you had any kinds of major medical vision issues like glaucoma or cataracts, or maybe even macular degeneration. Well, those types of major medical conditions would be covered under Part B. Now, Medicare also does not cover hearing aids or the exams for fitting them. Medicare does not cover long-term care that's personal or custodial. And by that, I mean if you needed any help with the basic necessities of daily living, so think of like bathing, eating, drinking, dressing, those types of things, they would not be covered under Part B. But again, there's a flip side to that. If you needed therapy services like outpatient physical, occupational, or speech therapy, they would be covered under Part B. Medicare new in 2020 now covers limited 12 acupuncture visits for 90 days for chronic low back pain. And then this always makes me laugh. Medicare does not cover cosmetic surgery. So anyone that is looking for a facelift, it's not going to be covered under Medicare. All right, a question we get all the time is, and what we find, is there's a lot of confusion about when should I enroll in Medicare? And you could be sitting here today on this webinar thinking, well, you know, I'm going to be turning 65. I have no interest in retiring. Or can I defer my Part A or Part B? Or I have a spouse that isn't Medicare eligible. What should I do? And this is our advice to you. Talk to someone, because as you approach age 64, and I don't know if anyone on this line can agree with this, but at 64 and a half, the floodgates open. And as I mentioned, you are going to be inundated with these messages concerning Medicare that will say, again, very scary and confusing things like you need to enroll or you'll be penalized. And that is not always going to be true for every situation. And what I hope that you learn from today is that we're not all the same. And we all might know someone that has transitioned into Medicare, but their situations could be different. Might not have that same situation as your parents, your siblings, your neighbors, or your coworkers. That's why we ask and advise, talk to someone that can help you through this transition. When you call our office, and I don't know, and again, if anyone has ever tried to Google Medicare or Social Security, there are thousands and thousands of pages on Medicare. When you call our office, we're going to tailor a web page based on your particular situation, and we provide that to you. And it's actually really great. There's a little video, there's all these links to the government resources like Medicare and Social Security, and then there's tons of information that will pertain to your particular situation. We'll also provide you with our recommendation of whether do you have a valid reason to defer or do you need to enroll. A question we get all the time is Medicare automatic? And the only time that Medicare is automatic is if you are collecting Social Security prior to your 65th birthday. Then you will have an automatic enrollment. If you have a valid reason to defer, you can return your Part B, and we'll talk about those valid reasons and how to return that Part B. On the back of your Medicare card, there's a little box, and you would just check that off, and you would mail it back in and say, I would like to return my Part B, because remember, your Part B is what you pay for. Now, for all others, if you're not collecting Social Security, the enrollment is not automatic. And if you have a valid reason to defer, I know this is counterintuitive, you do absolutely nothing. Now let's talk about some consequences that I had mentioned, penalties, deadlines, or gaps in coverage, if you do not move forward with Medicare in the proper sequence or in the proper timeline. You can, if you do not have credible coverage, be assessed some penalties. Now, Part A, there will never be a penalty as long as you are eligible for that premium-free Part A. Part B, on the other hand, there is a 10% penalty for every full 12 months that you have not had your Part B, and that penalty stays with you for life. Now, for Part D, there's a 1% penalty for each month you go without credible coverage after age 65. And again, that penalty stays with you for life. If you do not have credible coverage, you could miss deadlines. You could miss an initial enrollment period. You could miss a general enrollment period and be locked out of going and enrolling in any of these periods. You could have gaps in coverage because sometimes at age 65, Medicare becomes your primary insurance. And if Medicare needs to be primary for you and you do not have Medicare, then you will be responsible for that portion of the cost that Medicare would pay. And that's typically 80% of your medical care. Let's define what credible coverage is. Credible coverage is group health coverage based on, and this is the key words here, current active employment of the primary insured. That is credible coverage. Now, who's the primary insured? The primary insured will be the individual that is the employee. Now, if one spouse is the employee, the other spouse who is on the plan would also be eligible and would be considered to have credible coverage. But the primary insured would be the employee, the dependent could be the spouse, and they both would have that credible coverage as long as the employee is currently and actively working. Now, types of non-credible coverage include individual plans like the Affordable Care Act plans or the Obamacare plans, and then group plans not based on current active employment like COBRA, retiree, or severance plans. If you have credible coverage, you can defer Medicare, and you will not get a penalty if you do not enroll at age 65. So let's say now you had credible coverage, you were actively working, and now you're age 67. You'll have plenty of time to enroll because you'll have 8 months once the group coverage or your employment ends. Now, most people do not wait that whole entire 8 months. They do a seamless transition where they'll end their group plan, let's say March 31st, and enroll in their Part B and secondary insurances for April 1st. So it's a seamless transition from group plan to Medicare. So if your group coverage and your group plan is over 20 employees, your group plan will remain primary. So you do not need to enroll in your Part B. If your group insurance is under 20 employees, it's a different story. Medicare may need to be primary. So if that is the case, and if you're falling in that category, you would probably need to talk to somebody about that, because you will need to enroll in your Medicare Part A and Part B, and we'd have to dig a little deeper into your insurance. Now, how do you enroll after age 65 if you defer? You need to actually tell Social Security that you are on a credible group health plan. And the way you do this is by having a form filled out by your employer called a Request for Employment Information form. And this form, it's a one-page form, and you can kind of see on the right-hand part of the screen, there's a little screenshot, will have 2 critical pieces of information on it. One, that you were actively working and on a credible group health plan. You'll take this Request for Employment Information form and apply online for your Part B. And this will notify Social Security that you are not to miss, you haven't missed any penalties, you won't be assessed any penalties, you haven't missed any deadlines, and you can get right into the door of Medicare. We call it the golden ticket. Now, for all others, if you do not have credible coverage, again, Obamacare, Affordable Care Act, COBRA, retiree, and severance, our recommendation is going to be different. You will get a penalty if you don't enroll at age 65 because Medicare needs to be primary because it's not based on current active employment. If you have Obamacare, COBRA, retiree, or severance plans, you'll have a deadline to enroll. And that deadline surrounds your 65th birthday. So you'll have 7 months surrounding your 65th birthday, 3 months before, the month of, and 3 months after. Now, if you enroll the 3 months before your 65th birthday, your effective date will be the first of your birth month. If you enroll during your birth month, your effective date for your Part B will be the following month. Where it gets a little crazy is if you plan to enroll in the 3 months after your birthday, because Medicare defaults the effective date. So you could have a delay in your start date. It's very easy to enroll online, takes about 10 minutes. You would just need to have your computer set up and running. You can click on the link and you can enroll in Part B, as I said, within 10 minutes. All right, another question. Do I have to enroll in Part A? We hear this daily. You can enroll in Part A at age 65 or anytime thereafter without penalty or deadline, as long as you qualify for that premium-free Part A. However, there is one circumstance where it could be harmful to you, and that is if you are also enrolled in a health savings account. You cannot have an HSA and premium-free Part A. You can no longer deposit funds into that HSA after you enroll in Part A, but you can continue to use the funds in your health savings account. And those funds can be used to pay, if you're a Medicare Part A premium, if you don't qualify for that premium free. Part B, your Medicare Advantage plan, which is Part C, and then a prescription drug plan. And then any out-of-pocket medical expense. You cannot use your HSA funds for your Medicare supplement insurances. There is one thing that I would like to caution you about if you do have a health savings account. And so let's say that you are at 65, you deferred because you had a health savings account, and now you're retiring at age 68. You will have, when Social Security gets your application, your Part A will be backdated 6 months once you enroll, or no sooner than the first of the month of your 65th birthday if you're that close. So you need to be aware of that and take that into consideration. We counsel our clients in one of two ways, that if they know that they are going to be enrolling in Part A and Part B, and they have an HSA plan, we ask them to stop their contributions 6 months if they have that timing. You can also prorate your deposits. You can deposit a prorated maximum amount for the months you did not have Medicare Part A. And you have until the following April to make up for those deposits. So let's do a little example here. Let's say you're retiring on October 1st. Well, your Part A, and we're assuming that you're over age 65, your Part A will be backdated to April 1st. The maximum family contribution for 2022 for HSA is $7,300, plus there's a $1,000 catch-up amount for individuals over 50. So you can deposit funds for 3/12 of the maximum deposit for January, February, and March. So 3/12 of that maximum deposit of the $7,300 would be the $2,075, and you would have until April 14th of the following year to make that contribution. I love this next little chart. Am I required to enroll in Medicare A or B? This is a nice summary of the enrollment scenarios. So if your primary insured is actively working and on group credible coverage, now remember, it has to be over 20 employees, you absolutely do not have to enroll in Medicare, and you can defer. However, in a situation where the primary insured is actively working and it's considered a group credible coverage, but under 20 employees, you're going to fall in that maybe category, and we're going to have to do some research because Medicare might be primary, and if Medicare is primary, then you absolutely need to enroll in Part A and Part B so you'll have full coverage. And then lastly, in any of these situations, you absolutely need to enroll in Part A and Part B. Maybe you're not working, or you're on an individual plan, or you have no coverage, or retiree coverage, COBRA, or severance. Again, you absolutely need to enroll. Now, is there ever a time when you should consider Medicare if you're working? And we've talked to quite a few people and counseled them on this. And we'll ask them questions like, are you happy with your network? Are all your doctors and hospitals in the network? And what about your current costs, and not just the premiums? What are your out-of-pocket expenses, your co-pays, and your deductibles? And typically what we find and what we have found that the break-even is for plans with over 20 employees, if the group cost less than $3,600, group plan costs less than $3,600 a year, then Medicare, the group plan is going to be a more cost-effective option, and they should probably defer Medicare. The break-even is a little less, under 20, it's $2,400 a year. And if you have an age 65 spouse, this is always illuminating to people. Dependent spouses may have a higher cost on a group plan, which would make Medicare more attractive. And we have lots of couples where the employee will stay on the plan and the spouse migrates off if they're Medicare eligible, because it's that much more attractive. If the spouse, however, is under age 65, they're not Medicare eligible unless they're on SSDI or end-stage renal disease. So what we also find a lot of times is that the couple will stay on the group plan until both individuals are Medicare eligible. All right, so now we've just gone through the enrollment portion of Medicare Part A and Part B. Now let's talk about the cost of Medicare A and B. Medicare A and B, it's great baseline coverage, but as I said, there are out-of-pocket expenses to both. Part A, which is the inpatient, has a deductible of $1,556 for each occurrence and for each admittance into a hospital. Then there's additional copays for hospital stays after 60 days. You can see here it's $389 to $778 a day. And then for skilled nursing after 20 days, looks like $194.50. And then after 100 days, you're responsible for 100% of the costs. Part B, outpatient, has cost as well. There is a $233 calendar year deductible. And then after you pay that deductible, the Medicare becomes similar to an 80-20 plan where Medicare picks up 80% and then you're responsible for that 20%. And you're responsible for that 20% no matter how high it gets. Then there's something else called excess charges. And in 43 states, it is totally legal for doctors and hospitals to charge over and above, up to 15% over and above that Medicare allowable expense. And there's no maximum out of pocket there. So you see, there's some cost, there's some financial risk to only having Part A and Part B. And when you call our office, we will never say to you, just, oh, yep, only have Part A and Part B. We're going to talk to you about secondary insurances, which are going to help cover those costs. And they're going to come in the form of plans like Medicare Advantage plans, also known as Part C, or the Medicare Supplement plans, also known as Medigap plans. I'm going to talk about the Medicare Supplement plans because they're the easiest to shop. The benefit designs are standardized. And if you can see here, if you're following across here, the benefit designs are given letter names from A to letter N, with Plan F and G being the two most comprehensive. And if you're following down here, these are all those Part A and Part B costs that I just mentioned. Plan F and Plan G, and if you can see in the yellow, they are the only two plans that cover those excess charges. Now, if you were born prior to January 1st, 2020, you can get that Plan F. However, if you turn 65 after January 1st, 2020, Plan F and C are no longer available to you. So the most comprehensive plan, if you turn 65 after January 1st, would be that Plan G, would be the only plan that covers the excess charges. Now, there's other plans that have slightly lower premiums with maybe more out-of-pocket costs. There's a Plan N, and there's doctor's office visits, doesn't cover the excess charge. And then there's the high deductible G plan where you pay the first close to $2,500 before the actual insurance would start. And we'd be happy to talk to you about any one of these plans. But the most comprehensive plans are the F and the G. And here's just a real quick comparison. A Plan F typically has a monthly premium of $160. And with a Plan F, you have $0 out of pocket. With a Plan G, I didn't explain that very well. Let me go back here. With a Plan G, it covers everything that a Plan F does, with the exception of the Part B deductible. So Plan F covers everything at 100%. A Plan G covers everything but that Part B deductible. After you pay that $233, which is the Part B deductible, then you have 100% coverage. So let's go back here. So as I said, Plan F average $160 a month with $0 out of pocket. A Plan G, the average is about $135 in this area with the out of pocket of $233. Doing a quick math computation, there is a $300 premium, yearly premium savings from the Plan F to the Plan G. However, the first $233 is out of your pocket. So quite frankly, a Plan G nets you about $65 a year. So the reason why I wanted everyone to know, they're pretty equitable. So if you can't get a Plan F, I wouldn't be too worried about that. Now, as I said, Medicare supplement plans, very easy to shop, everything's standardized, it's the same benefits across the board. A Plan G in United Healthcare or Aetna or Humana will cover those Part A and B costs the same exact way. And it's the same claims processes too. Medicare makes the claims determination. So they're going to cover the claims across the board the same way in all carriers. With Medicare supplements, there aren't networks. Medicare's the network. You can go anywhere in the United States to get care as long as the doctor or hospital accepts original Medicare. And over 98% of doctors and hospitals accept original Medicare. So once you determine what benefit design you want, Plan F, Plan G, Plan N, a high deductible G, then the next thing to do is to shop premiums. Well, we have a quoting tool in our office, and I don't expect you to see this. And as I mentioned, we have access to over 35 insurance carriers, but Medicare supplements have rating factors of age, gender, and zip code. And we put that in, and we can get a report which will list all the carriers in your zip code in descending order. All right, now let's talk about Medicare Advantage plans. Now, Medicare Advantage plans and Medicare supplement plans, they vary in 4 different ways: the access to care, the cost, the extra benefits or the ancillary benefits, and when you can apply for these plans without Medicare, medical questions. I'm going to address the access to care. First, Medicare supplements are not managed. It's not a managed care plan. A Medicare Advantage plan are managed care plans. So you'll need prior authorizations and referrals. With Medicare supplements, there isn't a network, as we just discussed. Medicare is a network, and you can use any doctor that accepts Medicare. With a Medicare Advantage plan, these are network-based plans. So they're similar to PPOs and HMOs and private fee-for-service. So you want to make sure that when you're in a Medicare Advantage plan, your doctors are within that plan's network so that you can get care. And if you have an HMO that does not have any out-of-network coverage, if your doctor isn't in that network, you will not get care and you will be responsible for the total cost of that service. Let's talk about costs. Typically, Medicare supplement plans have higher premiums and approximately $100 to $250 a month. And you have to purchase a separate prescription drug plan. Premiums on Medicare Advantage plans are much lower. And I know we have all seen those $0 Joe Namath commercials during the fourth quarter. And even now, where they'll say, $0 premium. Most Medicare supplement plans, Medicare Advantage plans are between $100 up to $150 a month. The great thing about Medicare Advantage plans, it also includes a prescription drug plan. The one thing that is never addressed on these $0 commercials is the out-of-pocket expenses. With a Medicare supplement plan or a Medigap plan, as we just learned with a Plan G, your out-of-pocket expense is quite low. With a Plan G, typically about $233 a year. So it's always the Part B premium that the Plan G does not cover. With a Medicare Advantage plan, your out-of-pocket expenses are much higher. Medicare Advantage plans offer a suite of services. So you pay for your medical care as you go. So a doctor's office visit could be $10 or $20. A specialist could be $40 or $50. X-rays can be, or MRIs or PET scans could be anywhere from $100 to $300. You pay for your daily hospital stays. So you could be in a Medicare Advantage plan with an out-of-pocket cost of up to $7,550. And if you have a PPO plan that offers in and out of network coverage, it could be as high as $13,000. With Medicare supplement plans, you're capped at that $233. With Medicare Advantage plans, I do want to point one thing out, which is quite surprising to some people. Chemotherapy. With a Medigap plan, a Medicare supplement plan, your out-of-pocket is $233. But with a Medicare Advantage plan, if you are given a cancer diagnosis and you are given a round of chemotherapy or a course of chemotherapy treatments, you're going to pay that 20% coinsurance. So you're going to rack up and hit that out-of-pocket, that maximum out-of-pocket for that year. And if you straddle 2 years, let's say you're diagnosed at the end of 1 year and you're still being treated in the first quarter, you're going to straddle and hit those out-of-pockets for 2 years in a row. So that's something to always keep in the back of your mind. Now, ancillary benefits. With Medicare supplement plans, there's discount programs that come with certain companies. Like maybe there's you get a 25% off at a vision store, or maybe some hearing aid discounts. With Medicare Advantage plans, many of them now have dental, vision, and hearing embedded in the plan. Now, as of today, it's limited, and there could be network restrictions, but every year we seem to find that there are more and more provisions and more providers, Medicare providers, offering dental and vision services with the Medicare Advantage plans. And then there's those great extra benefits. I love the extra benefits on the Medicare Advantage plans. There's the gym memberships. They have over-the-counter benefits, drug plan benefits, meal programs. Some of them even offer all sorts of healthy living features. Again, with the Medigap or Medicare supplement plans, these extra benefits aren't typically included, and they come in the form of discount programs. And it's within, and they vary by company as well. Now, lastly, when can you apply for these types of plans without medical questions being asked? And initially, both the Medicare supplement plan and the Medicare Advantage plan, you can get in without any medical questions being asked of you. And annually on the Medicare Advantage plan, you will never be asked a medical question. So you can reshop your Medicare Advantage plan every year during the annual election period, which runs from October 15th through December 7th. And your health will have no bearing on whether you can change plans. With Medicare supplement plans, as I said, initially, no medical questions. You have a 6-month window of opportunity to get in and out of any Medicare supplement plan that you want that's available to you in your zip code. After that 6 months, the window closes. And if you wanted to change plans, you would be subject to medical underwriting. And what does that mean? You would have to answer medical questions on an application. You would have a personal health interview with a medical underwriter, and your medical records will be pulled and reviewed. And depending upon your health, you may or may not be able to change plans. So the point of the exercise, when you are first eligible to enroll in Medicare, it is the only time that you will have every single plan available to you without your health having any determining factor. So our recommendation to you, and we're always happy to talk about Medicare Advantage plans and Medicare supplement plans. But since Medicare Advantage plans are more complex, the benefits are different, the claims experiences are different, there's different networks across the United States, and the coverage varies across the United States. We want to make sure We shop everything, excuse me, and start by reviewing your non-negotiable doctors and hospitals, excuse me. You want to make sure that they're within your network so that you get coverage. Now, lastly, to round out your health package and your health care in retirement, we're going to talk about the prescription drug plans. There's about 12 to 30 plans in every state. Every plan covers an enormous number of medications. And all of these plans assign tiers to their drugs. A tier 1 and a tier 2 drug are your lower cost and generic drugs. Your tier 3 and your tier 4 are your higher cost and branded drugs. And your tier 5 are your specialty drugs. All of these plans have a couple things in common. They all run on a calendar year basis. So you can reshop this plan every year during the annual election period, which runs from October 15th to December 7th. They all have 4 stages. Now, Medicare keeps a running total of what's been paid for your drugs. And as you pick up your prescriptions, Medicare is going to push you through, depending on that cost, will push you through all 4, or could push you through all 4 stages of a prescription drug plan. And while you're in each one of these stages, you're going to pay a different amount for your drugs. So let's just briefly go over this. The first stage is called the deductible stage. And if your plan has a deductible, and many of them do, the total deductible, the maximum deductible for 2022 is $480. So if your plan has a deductible, you have to pay the full negotiated cost of that drug until you satisfy that deductible. After you satisfy the deductible, then you're moved to stage 2, or the initial coverage level. This is where you'll pay copays. And you'll stay in this copay phase until the total cost of your drugs is slightly or right around $4,430. And that $4,430 is based on what you've paid out of pocket and what the carrier has paid out of pocket. If you have either no drugs or take generic drugs, most people will never get out of stage 1 or stage 2. But if your drugs are expensive, you might be pushed to the 3rd stage, which is called the coverage gap, or formerly known as the donut hole. This is where you'll pay the most. You'll pay 25% of the retail cost of the drugs, and you're in there till about $7,000, slightly over $7,000. Once you pass that, then you'll be pushed to the 4th stage, which is the catastrophic phase. And this is where you'll pay the least. You'll get some relief on your drugs cost. You'll pay 5% of the retail cost of your drugs. And then unfortunately, everything is reset every January 1st. Now, the average prescription drug plan premium for the United States is $33 a month. We counsel many clients, and I believe that probably like 80 to 85% of our clients are on prescription drug plans that their premium is under $20 a month. But again, the prescription plans are based on your particular prescriptions. When you call our office, we're going to ask you for your drugs, and we're going to put them in a proprietary or not a proprietary Medicare Edge database. And we are going to run a report that's going to tell us which premium or which carrier covers your particular drugs in the most cost-effective way. So your spouse can be on one plan and you can be on the other. But rest assured that when we look at these plans side by side, we're going to make sure that they're covering your drugs in the most cost-effective way. Now let's talk about a Part D IRMA. I know this looks a little familiar to you, but if you were surcharged on the Part B premium, you're also going to be surcharged on the Part D. So this, again, as your income increases, so will the Part D IRMA. And IRMA is an income-related monthly adjustment. It's a per person, per month premium, and it it goes on top of the prescription drug premium. Now, after we are finished and we've talked, we're going to wrap up our presentation with a monthly premium report for you. Someone in the base income bracket with either a single filer of under $91,000 or a joint household of under $82,000 can expect to pay someone somewhere in the monthly range of $300 to $350 a month. And we'll lay this all out for you. We'll tell you what your Part A premium, your Part B premium, what Medicare supplement plan we discussed. We'll put in your prescription drug plan, and we'll come up with some number here. And that most likely, if you fall into that base income bracket, you're going to pay somewhere from $300 to $350. And as your income increases, expect to add about $100 to this range. With the highest income earners expecting to pay somewhere in the $800 and $850 range. And that's largely because of the increased Part B premium and the IRMA on top of that. So that is Medicare at a very high level in a nutshell, how to enroll, the cost and benefits, and some additional information on retiring with Part A, B, a secondary insurance, and a prescription drug plan. So thank you so much for listening today and being part of this webinar presentation. We're always happy to help. This is what we do all day, every day. We counsel individuals turning 65 or approaching retirement. You can give our office a call or email us. Our focus is on making sure that you feel empowered and that you have the right information to make good Medicare transition decisions.
Brenda, thank you.